Good evening. My name is Joshua Turnbull, and I'm here to talk to you about using magic mushrooms to support and treat individuals with clinical depression. Clinical depression involves low mood and/or loss of interest in usual activities, as well as many other symptoms, and it's a major public health problem, and is the leading contributor to the global burden of disease, which affects hundreds of million people worldwide. Now, antidepressant medications usually work for around 20% of people. They don't actually respond, and they tend to relapse into their depressive states. Magic mushrooms, or psilocybin mushrooms, are naturally found mushrooms that contain the hallucinogenic chemical psilocybin, which is 4-phosphoxy-NN-dimethyltryptamine. It belongs to the same chemical group as LSD, and they're native to Mexico usually. The article that I picked was published in May 2016 in the New Scientist, and it's called Magic Mushroom Ingredient Tested as Depression Treatment. One of the major discoveries of the past decade has been psychedelic science. And for this particular article, the researchers measuring the blood flow in the brains of the volunteers have been given psilocybin intravenously, and the researchers then found out that rather than increasing blood flow, it actually decreased blood flow to the DMN, which is the default mode network, which is the part of the brain that basically controls all the internal thought mechanisms, such as autobiographical thoughts, for example. Now, psilocybin has been the most promising of all the other illicit drugs that were tested, such as MDMA and ketamine, because they're better for more anxiety that they did find out. Now, psilocybin is a prodrug of psilocin, which is 4-hydroxydimethyltryptamine, and is a serotonin receptor agonist and classic psychedelic drug whose principal psychoactive effects are mediated by serotonin 2A receptor agonism. Now, the study being analysed involved an open-label feasibility study in patients with the treatment-resistant depression. However, there was no control group. There was a lot of inclusion criteria, though, which included an extensive amount of mental assessments for depression severity, and they also received a thorough blood check, which involved electrocardiogram, blood tests, blood pressure, heart rate, and just a physical exam. And then at the end of the screening, they then had to see 2 psychologists who would then help them and aid them throughout the whole trial. Patients received a low dose of psilocybin, 10 milligrams, on the first dosing day, and then a week later, a high dose of 25 milligrams. And these were the only 2 dosing days in the entire study, which was conducted between May and August 2015. Throughout the dosing, the patients were given individual assessments so that they could rate themselves, as well as the psychologists watching on were then also testing them. And this was used to basically gain all the research they needed for the results. Now, the depressive symptoms were then assessed between a week and 3 months later after the test as well. Now, the results were quite good, considering there was no control group. Psilocybin's acute psychedelic effects typically became detectable after about 30 minutes to 60 minutes after dosing, and they peaked at about 2 to 3 hours and stopped at around 5 to 6. Now, the mean self-rated intensity, which was on a 0 to 1 scale, was 0.51, with a 0.36 standard deviation for the low dose, and a 0.75 with a standard deviation of 0.27 for the high dose session. Psilocybin was well tolerated by all patients, and there were only a few side effects, which involved transient anxiety, which was due to actually taking the drugs, transient confusion, and also thought disorder, as well as nausea and a headache in 4 patients. Now, overall, relative to the baseline, which is the mental assessments they were given before they started, the depressive symptoms were remarkably reduced 1 week, with the QIDS difference being negative 11, with a standard deviation of 8. And then after that was after a week, and then after the 3 months, it was negative 9 with a standard deviation of 2. And this was both of the high dose. And this was quite remarkable, considering. Now, the amygdala is roughly an almond-shaped mass of grey matter inside each cerebral hemisphere, and is involved in the experience of emotions, so it's part of the DMN. Now, the amygdala, so as you can see on your screen, it shows that the amygdala is extensively interconnected with the medial prefrontal cortex, and it shows how it then connects to lower levels of anxiety and effective emotion regulation. Now, the 5-HT2A receptor activation by psilocybin attenuates amygdala activation in response to threat-related visual stimuli in healthy volunteers, and the reduction of amygdala blood oxygen level dependent signal is related to the psilocybin's mood-enhancing effect. The connectivity changes between the amygdala and visual prefrontal cortical areas contribute to the observed top-down connectivity from the AMG to the visual cortex, and this underlies the psilocybin effect on the visual threat processing. So this result suggests that decreased threat sensitivity in the visual cortex during emotion processing may explain the potential of psilocybin to accurately shift emotional biases away from negative towards positive. And this capacity of the visual cortex to process multiple stimuli is limited because there's not enough flow going to the DMN, as stated before, and hence top-down suppression of negative stimuli enhances the processing of positive stimuli. Now, in conclusion, it shows that using magic mushrooms is actually a safe and it's quite effective as well for the psilocybin, for the treatment-resistant depression, for the people who the antidepressants just didn't work for. And so with more rigorous designs and further trials, it can be used as a better potential. However, overall, more studies are required for this treatment. Thank you.